Some of Britain's top experts in smoking and addiction say thousands of lives could be saved every year if smokers switch to electronic cigarettes. Their advice contradicts recommendations from the World Health Organization, which said last week that e-cigarettes should be banned indoors. As our health editor Hugh Pym reports, it's left many smokers confused.
Getting a clear picture in this debate isn't getting any easier. Last week, global health chiefs warned of the potential dangers of e-cigs. Now, British experts say that's misleading and they're far safer than cigarettes.
What sort of flavours are you looking for? Like fruity flavours?
No surprise they're popular among staff at this Lancashire-based e-cigarette business, Totally Wicked. Some smokers are switching to e-cigs as they still have nicotine, but the vapour, produced by heating a fluid electronically, is a lot less damaging than tobacco smoke. And experts backing e-cigarettes say tens of thousands of unnecessary deaths can be avoided.
If people were to switch wholeheartedly or completely to e-cigarettes, and even if they carried on using them for the rest of their lives, we'd be looking at cutting that number to no more than a few thousand at worst. So it's a huge potential public health gain.
In less than a decade, e-cigarettes have gone from a standing start to a £1.8 billion global business. Today's report says they could prevent 6,000 early deaths a year if 1 million smokers switch from tobacco. But last week's report said use of e-cigarettes amongst adolescents had doubled globally over 4 years. And that's why some argue there's a danger of enticing younger people into a habit they may later regret.
The biggest worry really for us is that these cigarettes might be used to get a whole bunch of young people into the nicotine habit, and a highly addictive substance. We don't know what effect that will have in the long term. We need more information, we need more regulation. The beginning of a new surge here with e-cigarettes, so we just don't know enough about these things yet to say thumbs up.
With apparently mixed messages coming from the medical profession, perhaps it's not surprising that businesses are taking differing views. In pubs like this one, for example, you're allowed to use e-cigarettes in the bar. But here they're banned. Management at this bar say it's simply too difficult for staff at busy times to work out who's smoking tobacco and who's using e-cigarettes. There's a big marketing push on e-cigarettes as major tobacco companies have been buying up some leading brands. Another twist in this often confusing story.
Because it's vapor, not tobacco smoke.
Hugh Pym, BBC News.
The Lord Mayor of London, Fiona Woolf, has replaced Lady Butler Sloss as head of the government's inquiry into historical